Well, we've known for quite some time that physical activity confers health benefits. But for quite a while, people tended to think about physical activity just in terms of weight loss and weight control. But we now know that there are a range of benefits to physical activity, both in physical and physiologic domains, as well as areas that are considered more psychosocial in nature, such as mental health and spiritual well-being. And when it comes to breast cancer survivors, physical activity is also tremendously beneficial because we have a fair amount of evidence now to indicate that physical activity is linked to reduction in breast cancer recurrence as well as death from breast cancer. So in addition to all of the physical benefits and physiologic benefits seen in the general population, we see the same thing in our breast cancer survivors as well. There's reduction in fatigue, there's reduction in risk for lymphedema, there's increases in energy, and there's improvement in body image, self-esteem, and sexuality. So again, we've known for a while that physical activity is beneficial and is one of the better tools that we have in terms of health promotion and disease prevention. However, unfortunately, we do know that most Americans do not engage in recommended levels of physical activity, and the same is true among breast cancer survivors. One of the things that we try to do is to promote lifestyle changes among individuals in the Deep South area. We generally encourage people to try to eat a healthier diet and to increase physical activity, not only as a form of obesity treatment, but also in terms of breast cancer prevention. There are currently studies going on throughout Alabama and Mississippi, a few of which I'm a co-investigator on, where we've enrolled African American women to adopt these lifestyle behaviors, as well as cancer survivors and their family members as well. So according to the American Cancer Society, and this is supported by work from the American College of Sports Medicine, women should aim to engage in 150 minutes per week of moderate intensity physical activity or 75 minutes per week of vigorous activity or some combination of the two. And when I say moderate activity, I'm referring to activities that lead to a slight increase in heart rate or breathing, but you could still probably hold a normal conversation, so something such as walking. When we refer to vigorous activity, these will be your activities that lead to greater increases in heart rate and breathing, things such as running. So the first thing I would recommend is to consult with their physician, consult with their healthcare team about the best plan. We have research now that suggests that it's safe to begin physical activity even during treatment, although that may need to be at a lower level. But we just encourage people to do something, start moving, and then make gradual increases towards the eventual goal of 150 minutes per week. Well, physical activity is routinely needed both from a behavioral standpoint as well as a physiological standpoint. So when we think about it from a physiological standpoint, it's believed that spreading the activity out over the course of a week rather than trying to do all 150 minutes in one session, so for example, instead do 30 minutes 5 times a week, confers some physiologic benefit, increases fitness, and it also minimizes risk for fatigue and injury. When we think about it from a behavioral standpoint, routine activity kind of helps to make it a habit. So if people tend to start to integrate it into their regular routine, it becomes more of a habit and something that's sustainable over the long term, which is the ultimate goal.
Right.
So a few practical tips for getting physical activity after consulting with a physician. The first thing I would say is to set what we call a SMART goal. And in the behavioral science arena, SMART is an acronym to help with goal setting, which means we want the goal to be specific, measurable, attainable, realistic, and time limited or time defined. So we should not just say, I'm going to start being more active. Instead, we should say, I'm going to complete 30 minutes of physical activity 5 times per week each week. In addition to setting SMART goals, again, I encourage people to make it a part of their daily routine and integrate it into the day. Think about physical activity in terms of active transport, so walking to the store or to the restaurant instead of driving, or taking the stairs instead of using the elevator. Also, social support is a big thing. So I encourage people to engage their partners, their friends, their family members, their caretakers in their efforts to be physically active so that they can have someone to have some fun with and also have an accountability partner. So there are a lot of great resources. The American College of Sports Medicine is the authority on physical activity in the U.S., so that's a great place to start about physical activity broadly. In terms of cancer-specific resources, there's the American Cancer Society, the Susan Komen Foundation, as well as the Young Breast Cancer Survivors Network and Survive AL that can provide some great resources. Additionally, I invite you to follow me on Twitter at Dr. Tiffany Carson, where I try to share new health-related discoveries as they become available.